Hey, have you ever been to a massage therapist for an issue, say with something wrong with your shoulder, and you get there and they start to work on something completely different and they find something else wrong with you? What's up with that? Hey, we're going to talk about this today. My name is Ben and I'm a massage therapist, and today we're just going to talk, we're going to call it blog style. I've never really done a blog before, but I have this concept. I want to call it creating a pathology from an observation. So let's dive into this. I want to share some of my thoughts and experience with this creating a pathology out of an observation and get some of your feedback, see what you think about this, let you process it, kind of go from there. So, hey, my name is Ben and I'm a massage therapist. I've been a massage therapist for 18 years. That doesn't mean I know anything, but I'm making videos about it. All right. So let's talk about this making a pathology out of an observation. How many of you have had clients come in with some type of issue and we find something else going on wrong with them, right? And we address that before we address the thing that they came in to see us for. I've heard this called the nocebo effect. So now we are giving the client something else to worry about. They came in for headaches and now they have to worry about carpal tunnel or something crazy that they weren't even worried about before. But now because the massage therapist that worked on them says that their flexors are really tight, they're going to have carpal tunnel issues. So let me share with you a story of that I experienced a few years back. I went into a massage therapist wanting work on my shoulder. And I said, I really just would like just whatever you can do with my shoulder today. I don't really want anything else worked on. I just would like, I've been having issues with my shoulder and I just want some good soft tissue work to my shoulder. So through this session, this particular massage therapist found through observations and assessments that my rib cage was not in the place that it should be and started working on my rib cage and not working on my shoulder. Now, I don't disagree that maybe rib cage issues could contribute to my shoulder issues, but that's not what I was there for. I wanted my shoulder worked on. And how many times do we as massage therapists have someone come in complaining of an issue and we find another issue to work on? How many times do we as massage therapists have clients come in and describe their bodies as super tight or a train wreck or you can't help me, I'm all messed up. And we fall into the trap and we say, oh yeah, you're all messed up, you need work. Well, through some of the stuff that I've been reading lately and listening to, our expectations really shape a lot of the therapeutic outcome. So if we as massage therapists are telling people what's wrong with them, we are just propagating the nocebo effect, or we're making more issues out of something that may or may not be there. And one of our main goals as massage therapists should be helping people, and we treat people, right? Not bodies. We work on bodies, but we treat people. It's all about retraining the brain, right? Brain-based body work. We're not going to dive into what that means, but you get the idea. So our goal is to create this therapeutic presence, this therapeutic alliance, everything that goes into establishing credibility, rapport, all these good things that we want to bring to the people that come see us. We don't need to continue to tell somebody what's wrong with them because they're pretty good at telling us what's wrong. We need to tell them what's going well and how we are going to help. That's one of our main jobs as a massage therapist, is pointing out the positives and staying away from the negatives and persuading our clients to stay away from the negatives. Part of the process of creating this therapeutic presence is establishing trust, right? It's been shown that people who trust their healthcare providers have better outcomes than people who don't have as much trust in their healthcare providers. Think about that a little bit. So how do we create this trust? I mean, it starts from the second we answer the phone. Hey, you called the right place. I know you're looking for work and you called the right person. I'm going to do everything I can to help. When they show up, hey, I'm so glad you're here. Hey, how's that shoulder doing? One of the great ways to create trust in people is really comes down to one of the main reasons that people get into healthcare is the name is right in there. Care. Show them that we care. If you are in any kind of healthcare profession and you don't care about people and you're just churning people in and out, it's going to show and people are going to know. So let people know that you care. How do you show them that you care? There's different ways. One of the ways that I show people that I care is I'm constantly investing in myself with continuing education. I'm always trying to learn more. I'm one of those people that I need to review something over and over and over and over and over again. I'm not gifted with the ability to read something once and completely understand it. So that's what I do. I review and I keep learning. And I share what I've learned with people because I believe that letting them know that I care enough to invest in my knowledge to help them better lets them know that I care. I let them know, hey, I don't know everything. And that's why I have books to refer to. And there are a lot of times where in the treatment room, I say, I don't know, but I will look it up and I will do what I can to learn as much about this as possible so that we can help you and make this better. And you know what? I have a lot of people that come see me that are in great shape, but they continue to come see me because they want to stay that way. And I think that's credits the way that I show people that I care. So let's go back and talk about creating a pathology from an observation. So what are some of the things that we can do to not fall in this trap of creating a pathology out of an observation? Well, the first thing that we need to do is address the complaint. So if someone comes in with headache, shoulder pain, low back pain, we need to address that area. What does that mean? Well, as hands-on practitioners, we need to touch that area. We need to put our hands on that area. We need to do some assessments in that area. I mean, of course, we're going to look globally to find out what other issues may be causing problems. But if we don't address that headache and touch that head and neck where they showed us, I'm having headaches here. If we don't address that spot and someone is expecting us to address that spot and we don't ever touch it, that can greatly influence the outcome. One of the biggest factors of someone getting better is the expectation that they're going to get better. And there's a lot of things that go into that. But if someone expects us to touch the spot that hurts, we better do that. Regardless if we think it's going to have a therapeutic outcome or not, we need to address that area. We also can then educate our clients on what things could be possibly influencing their pain. And this allows us to address some different areas on maybe a next visit. Hey, today we really focused on that area in the head and neck where you're having your neck pain. So next time, I think what we'll do is we're going to spend a little bit more time on some of the areas that may be influencing that area and causing some of that pain. What do you think about that? So that continues to establish that trust and influences that expectation on how we're going to treat our clients. Now let's talk about the end of a session. At the end of the session, massage therapists often get the question, so what did you find? What's going on with me? And this is another area where we fall into the trap. Well, I found some really tight muscles in your low back, and I think there were some restrictions and adhesions in your hamstrings, and there was a lot of stuff going on in your pecs. There's a lot of stuff that's bad that we need to work on. So we fall in those traps. So we shouldn't be falling into those traps that those clients set out for us. Not that they're traps, but let's put in the positivity, right? Let's tell them what went well. Here's what I found. Your tissues responded great to the work. I think we're going to need a little bit more time to help influence these tissues, but things went really well today. And here are some other things that you can do on your own to help progress your body's ability to get better. So take it upon yourself at the end of a session to give people hope, positivity, give them something good. Don't give them bad news. Give them good news. Hey, guess what? We get to do another massage in about 2 weeks because you know what that's going to do? That's going to help increase your range of motion, ease of motion, and quality of motion. And that's going to help your overall well-being. And that's going to help your shoulder that you came in to see me for. Or that's going to help your headaches. Or that's going to help this or that. So we educate them on the benefits and why they need to do what they do to make themselves better. So once again, it all comes down to caring. If we care, we're going to do everything in our power to help the person on the table. So tell me, what are your thoughts on not creating a pathology out of an observation? Does this concept make sense? Is this something that you do when you're in your massage room and treating your clients? So hey, I appreciate you watching this video, taking the time to dive into some of this stuff with me. If you got something useful out of this video, share it down in the comments. I'd love to know what kind of things you have to add to the conversation. Like I said, I don't know everything. I'm just going to share some stuff that I've read and experienced, and let's discuss it a little bit. It seems like the more I learn, the less I know. So I need to go over this stuff over and over, and making videos about it is one of those ways that I can process it. So hey, thanks for watching, and I hope to see you again in another video.